I am William Culbertson from Bascom Palmer and chair of the Optomedica Medical Advisory Board. There are 4 steps in the Catalys procedure: planning, engaging, visualizing, and customizing and treating. These steps are shown in real time for a case I completed at the Centro Laser in the Dominican Republic using the Catalys Precision Laser System. Dr. Rafael Feliz plans the procedure using intuitive template-based software before the patient arrives. This case is a capsulotomy and complete softening for a grade 3 cataract. After a surgical timeout to confirm that I will be treating the correct patient and eye, I position and stabilize the patient's head. Under a topical anesthetic, I first place the liquid optics interface on the eye. I apply suction with a foot switch, and once a seal is established, I fill the ring with balanced salt solution. Its 13.5 millimeter clear aperture allows me to easily center the suction ring on the limbus, viewing sclera around the pupil on all sides. This also provides a large diameter range for incisions. The docking with the liquid optics interface is gentle, with a low intraocular pressure rise of about 15 millimeters of mercury, and with only minimal subconjunctival hemorrhages after laser treatment. I rotate the patient under the system and raise the bed using the joystick. I can feel the suction ring connect to a disposable lens which is already attached to the system. The lens contacts the fluid, but does not come in contact with or applanate the cornea. Once the eye is in video view, I am assisted by on-screen docking guides. I adjust the bed position and raise the patient into the capture zone as indicated with the green arrow. Then I try to center the red ring shown on the video with the outside of the suction ring. In the middle of the video, I have a force sensor that shows the force vector in direction and magnitude to help ensure that it is a gentle and stable dock for the patient. The software leads me through the docking steps of vacuum, capture, and lock, so I just adjust the joystick and press those buttons. When docking is complete, I confirm that there are no air bubbles in the BSS that might disturb the imaging or laser. The OCT imaging starts. Again, this is shown in real time. The Catalys system's integrated video and 3D spectral domain OCT visualized from the anterior cornea through the posterior lens. Sophisticated algorithms automatically customize the treatment plan in 3D for the patient. Together, the process is called integral guidance. The capsulotomy and fragmentation are displayed on top of the video. Catalys automatically centered the capsulotomy on the pupil as shown on the left in yellow. I touch one of the cross sections and can confirm the surface fits by hiding them to view the raw OCT. I also review the safety zones in red for the iris and along the posterior capsule and the incisions in purple and teal. Notice the image shifts as I change to view the sagittal cross-section. This demonstrates that tilt is present, but I can confirm that the system has already accounted for it automatically. After final review, I press the pedal and the treatment starts. Capsulotomy takes about 4 seconds in this case. It has adjusted for the detected tilt so it can cut evenly in the anterior capsule tissue. Then we make the lens softening, starting at the posterior safety zone, 500 microns from the posterior capsule and moving anteriorly. It is essentially pre-chopping the lens with a femtosecond laser. In this case, we decided to divide it into 4 quadrants and then soften completely with a 500 micron grid. Catalys uses a proprietary state-of-the-art fiber laser created specifically for this application. The laser delivers the cuts rapidly. If I hide the overlays, I can see the laser is delivered accurately and precisely in the intended location. The system has other built-in safety features too. During treatment, the system and I are both monitoring the force sensors to calm the patient if she tries to move. When the treatment is complete, I can release the patient by pressing the vacuum off button. Then I lower the patient bed with the joystick. This is an example of an average case with about 3.5 minutes of total suction time. I think we can only get better from here. We take the happy patient to the operating room and proceed with the surgery. I can see the capsulotomy is completely free in this case. I do lift it off using capsulorhexis technique to ensure safety just in case there is a residual attachment that I cannot see. Then we hydrodissect, and you can actually burp out a little gas that is collected in the lens. As far as phaco goes, I think divide and conquer is back. You don't need to chop under the capsule or behind the iris. On this grade 3 cataract, I create a few grooves and then pull it apart, and it divides nicely down the middle. We have found that the pre-treated lens has a big advantage in both soft and hard lenses like this one, requiring only 40% less ultrasound energy. Once you have the 4 quadrants divided, because it is pre-chopped, you can phacoaspirate the lens pieces out. After the cortex has been removed, you can see here a nice view of the perfectly sized, centered, and circular capsulotomy as I inject viscoelastic, and again with the IOL in place. There is perfectly symmetric overlap as designed. We have designed features in Catalys that maximize precision, safety, and control at every step of the procedure. It really is an incredible procedure.